Welcome to another episode of Practicing Anti-Racism Clinically. For our last segment of the podcast, we have created mini episodes talking to working psychologists in different areas of the field about how they are implementing diversity, equity, and inclusion work, and how they can better improve these practices within their given role. We've invited guests spanning several positions in several states, from clinic directors to faculty members to practicing clinicians and more. We are excited to hear their perspectives and how cultural humility and anti-racist practices can be implemented in their respective settings. Here is who we will be talking with for this mini episode.
Dr. Hollingsworth is a licensed clinical psychologist at the Tuscaloosa Veterans Affairs Medical Center and previous graduate of the Oklahoma State Clinical Psychology Program. During his time here, he was under the mentorship of Dr. Larica Wingate, where he conducted research examining risk and resilience factors for suicide in ethnic and racial marginalized communities.
Hi, I'm Gina Irado, and I will be hosting this panel guest episode of our Practice Arc podcast with Dr. David Hollingsworth.
Hi, my name is Dr. David Hollingsworth. I am a graduate of the Clinical Psychology Program at Oklahoma State University. I graduated with my PhD in 2017, and I am currently a clinical psychologist in an outpatient mental health clinic at a VA hospital. With that being said, everything I say here is my personal opinion, and I do not represent the Department of Veterans Affairs or the United States government in this interview.
So Dr. Hollingsworth, tell me a little bit about your role as a OSU clinical psychology alum and a VA psychologist.
Yeah, so thank you again for having me. So my current role as a psychologist, I see veterans Monday through Thursday, working in the mental health outpatient clinic, which is pretty much like a general mental health clinic. So mostly treating depression, anxiety, stress, and anger management. Of course, coming from OSU, I am trained in CBT. So I use that as my theoretical model with all of my veterans. Even for some veterans who aren't looking for a structured treatment, like on a weekly basis, sometimes might meet monthly. But I'm still very much big B, behavioral activation, and people making sure people are trying to stay active. I know Dr. Left won't really like that. Trying to get people to stay active, because obviously that improves their mood. And I also have other roles there at the hospital too. So I have some time to do research actually. And then every VA has LGBT veteran care coordinator. So they're the person who's the point of contact for LGBTQ plus issues. I should say that it was recently changed to LGBTQ plus veteran care coordinator. So with that, just being the point of contact for those services for LGBTQ plus veterans. So yeah, and most doing individual therapy. We did groups pre-COVID, that's kind of postponed now. And then we have an internship as well. So I supervise our doctoral interns too.
So within that role as a psychologist at the VA, and after listening to and reviewing some of the previous episode material, what stood out to you the most, and how does that apply to cultural humility or multiculturalism in your field?
One of the things that stuck out to me was the part about being self-aware of your own values and your own biases in the therapy room, particularly when working with not only people of color, but people of different ethnicities, and sexual orientations, different SES, because obviously we would hate to have a native experience between you and your client for something that you may have incidentally said, but you said because you weren't quite aware of your own biases that you might have in that room. And as a therapist or a psychologist, there is a power differential, right? You have this knowledge that you are sharing with your client. And they're looking to you for that knowledge in a collaborative way, but still would hate to damage that therapeutic alliance and rapport by making a comment that one would get offended by. And I think one of the first steps to making sure that doesn't happen is to be aware of your own biases that you might have and your own values.
What steps have been made to promote cultural humility and a multicultural framework in therapy and/or research so far in your department?
Yeah, so for me personally, when I work with clients of color, I ask, if they've experienced any type of racism before, and thinking about how that might tie into their presenting problem. So even including that into the conceptualization piece of it, right? So, did this racist event lead to a depressive episode, or was it tied to some type of traumatic event that might have happened? I think is really important. And there's actually some research showing that there are some researchers supporting the idea that experiencing racism is a criterion A event to be diagnosed with PTSD. I know there's a camp out there doing that. So yeah, so I do that with my patients of color. And then in terms of research, I've done a lot of research on microaggressions and how that impacts mental health, specifically suicide risk in minorities. And I also have done some research on ethnic identity. So identifying with your ethnicity, particularly African Americans, and how that can be a protective factor against particularly suicide, which is my field of study. Those are the two ways that I've kind of included these type of things into my own clinical work and then also with research as well.
Yeah, that's awesome. And I love hearing kind of the two levels of like individually with your client and the person that's in front of you, but also at this level within the field of like pushing research forward. That's awesome. In what areas do you believe we as practicing psychologists require the most growth?
I really think that something we need more of is training, particularly in this type of area. And I know that, all APA programs have like that one diversity course, that one semester, but I really think we need a lot more of it because nobody really teaches you what to do if your client says something racist in your appointment. Like, how do you handle that? Do you say nothing and then maybe reinforce that it's okay to say these type of things to people? Do you say something and then possibly damage the therapeutic alliance or rapport? Like, what do you do? So I really think that we need more training in this type of area, particularly given the current climate of the country. Because obviously we want everybody to feel safe in the therapy room and able to share their what they're experiencing and what their thoughts are. But again, if we're here to treat people, how can we handle this in a therapeutic way? So I think that's one thing that we really need to grow in as a field.
Yeah, and that really is at the entire field level when it's coming down to our most basic training to make us experts. And I think that is really just kind of like the most holistic approach at the outset. We need to be emphasizing and like learning these things. What are current goals you and or your program department are working towards to improve DEI in your program as well as its services?
One goal that I think any clinic would want to have is to make the environment a welcoming environment for everybody, right? So one thing that we have done is we did like a panel, or like no, not a panel. We did a focus group on our on clients who are African American and seeing what are their experiences like at the hospital, and if they had negative experiences, how can we go about making these experiences better for them? And again, wanting to get their care at the hospital, and what things do they want to see change? Again, how can we be helpful in helping them reach their health goals? So that's one thing that I think that we should continue to do, is asking our clients, like, what do you want to see? This is where you get your health care. Like, what do you want to see? And again, if they have had negative experiences, how can we make sure those negative experiences don't happen again in the future?
Yeah, absolutely. And I have an off-script follow-up question, but that I think falls in line with this, is you mentioned the shift in your title. You're like, oh, we're LGBTQ plus now coordinator. Can you just share a little bit about that process of how that letter and like plus sign was added?
Yes. So essentially wanting to be more inclusive of, again, obviously LGBT, lesbian, gay, bisexual, and transgender, but also wanting to include people who are questioning, who maybe identify as being queer, or maybe asexual, or non-conforming or non-binary, right? So just making sure we're encompassing everybody, as many people as possible. So we don't want people to feel left out, because these services are for them as well. So that was the push to add the Q plus to the title of it.
And I think that demonstrates something that like is small and administrative, but that is hoping to have like rippling effects of like the
Mm-hmm.
people that you
Mm-hmm.
serve.
Yeah, I mean, because I think, what if somebody does identify as asexual, right? And they see something as just LGBT, they may not think that that is services for them. So again, just wanting to be inclusive of everybody with that.
All right. And our last question already. Are there barriers that prevent us from diving deeper as a program or field? How can these barriers be addressed?
I think that obviously talking about race is a touchy subject, and it's a subject that a lot of people are uncomfortable with discussing. And I think that as psychologists, we're the main ones who typically have these difficult conversations, right? And I think that for us to really continue to move forward, it's going to be having these type of hard conversations. If we are too uncomfortable in having them, then we aren't going to move forward. And if, as a field, particularly as it comes to these type of problems. So, psychologists, we ask a lot of personal and, and deep questions. And I think that this should be no different, right? We should get used to asking these type of uncomfortable questions and having these type of uncomfortable dialogues. And as we know, we tend to get more comfortable with them over time, right? And I think that us being afraid or uncomfortable about having these conversations will prevent us from diving deeper.
Definitely. We're in the business of difficult conversations. That's like
Right.
an oversimplistic job description. And I think we do more harm by not getting training on really important, tough conversations, like
Mm-hmm.
talking about race and racism.
Mm-hmm. And I also want to add on there too, like I am so proud as an alum that you all are doing this. Again, I'm just really happy to see that you all are doing that and things seem to be going well. And things were definitely a bit different when I was in graduate school, for sure, in terms of the climate. But again, I'm just very happy that you all are doing this. So thank you all for doing this. I know it's a lot of work, stuff that you don't have to do. You're already busy with everything that you already know about being a graduate student. And I know how intense our program can be. So again, thank you for doing this and setting this up.
Oh, thank you so much for saying that. We feel so lucky to have you as an alum, to have you on the podcast, willing to share your time and thoughts with us.
Thank you for listening to this episode of Practicing Anti-Racism Clinically. This podcast was funded by an award from the APIC Call to Action on Equity, Inclusion, Justice, and Social Responsivity. Resources associated with today's episode can be found at our website at psychology.okstate.edu. That's psychology.okstate.edu. If you hover over the Diversity tab, you can find the Student Diversity Committee. By clicking this link, you can find the Practice ARC podcast tab with all associated resources and supplemental materials for each episode.